Today we are diving deep into Hyperemesis Gravidarum. It's a condition that is so much more than just typical morning sickness. We're going to break down what it is, what causes it, and, most importantly, how it's treated. So let's get right into it.
You know, everyone's heard of morning sickness. It's practically a cliché of pregnancy. But here's the question. At what point does it cross a line? When does it go from being a normal, albeit unpleasant symptom to a serious medical condition that needs real help? That's the line we're going to define today.
So let's start by drawing that line in the sand. We're not just talking about feeling unwell. We're moving into the realm of specific, measurable, clinical signs. This is the point where morning sickness gets a real medical diagnosis.
So what exactly is Hyperemesis Gravidarum, or HG? Well, the clinical definition is super precise. This isn't just about throwing up a lot. The key is the consequences of that vomiting. Losing more than 5% of your pre-pregnancy body weight, getting clinically dehydrated, and having your body's essential chemistry, your electrolytes, get thrown completely out of balance.
Now, you might look at that number and think, okay, that seems pretty rare. But get this, even though it affects a relatively small percentage of pregnancies, it is one of the single most common reasons for a pregnant person to be admitted to the hospital in the first half of their pregnancy. That alone tells you just how incredibly severe this condition can get.
To really get why HG is so different, we first have to establish a baseline. You know, what does normal look like? For typical nausea and vomiting in pregnancy, there's a pretty predictable pattern. It usually starts somewhere between weeks 4 and 7, it hits its absolute peak around week 9, and then, for the vast majority, it's pretty much gone by week 20. Keep that timeline in your head, because it's a really important comparison.
And here you can see the difference side by side. It is night and day. Normal morning sickness is miserable, no doubt about it, but it doesn't usually lead to actual weight loss or dehydration. HG is just in a completely different league. It's prolonged, it is severe, and it has those clear, measurable, and frankly, dangerous effects on the body.
Which leads us to the million-dollar question, why? What is actually happening in the body to cause such an extreme reaction? Well, it seems the answer lies with one very specific hormone.
The main suspect is a hormone you've definitely heard of, beta-hCG. Yep, that's the same hormone that pregnancy tests pick up. In early pregnancy, its levels just skyrocket to support the pregnancy. But for some people, that massive hormonal surge completely overwhelms the brain's vomiting center. It's like the system gets short-circuited, leading to that constant, severe nausea.
So are some people more likely to get this? For sure. If you've had HG in a previous pregnancy, that's a huge predictor. And then, it makes sense that anything that leads to even higher HCG levels also raises the risk. We're talking about a multiple pregnancy, like with twins or triplets, or a very rare condition called a molar pregnancy. It all points right back to that primary hormone trigger.
Because this is so serious, getting a correct and timely diagnosis is absolutely critical. And it's not some quick judgment call. It's a very methodical process that's designed to be absolutely certain and to rule out anything else that could be going on. This is a really crucial clue that doctors use. Since both normal morning sickness and HG almost always start pretty early in pregnancy, if severe symptoms suddenly pop up after about 10.5 weeks, that's a red flag. Doctors will immediately start looking for other causes. You know, maybe it's a bad stomach bug or a UTI or something else entirely. It's a critical safety check.
So the assessment is really a two-part process. First, there's the history. The doctor just listens, asking a ton of questions. How often are you vomiting? Can you keep anything down at all? What's happening with your weight? Then comes the physical exam. This is where they look for the objective evidence, the physical signs of dehydration, changes in your pulse and blood pressure, or any tenderness that might point to a different problem. After that initial assessment, the investigation gets more detailed. It's basically a 3-step process. First are simple bedside tests, like checking the urine for ketones, which are a dead giveaway that the body is in a state of starvation. Step 2 is lab tests, so blood work to see exactly how bad the dehydration and electrolyte loss is. And finally, step 3 is an ultrasound. This is essential to confirm the pregnancy is progressing as it should and to check for those risk factors, like twins.
Okay, so a diagnosis has been confirmed. Now what? Well, the good news is there is a very clear and structured way to manage this. There are options.
The most important thing here is that treatment is not one size fits all. It is completely tailored to how severe the symptoms are. Think of it like a tiered or stepwise approach, just to make sure the level of care perfectly matches the level of need.
And this chart shows how that works in the real world. A mild case can often be managed at home with medications you can take by mouth. Moderate cases might mean going into a clinic for a few hours for what's called ambulatory care to get some IV fluids and medication. But the severe cases, where someone literally can't keep anything down, that requires a full hospital admission for intensive, around-the-clock management.
What's really reassuring is that there is a logical, step-by-step approach to treatment. Doctors have a whole ladder of options. They'll start with first-line anti-nausea meds. If those don't cut it, they move up to second-line options, which work in different ways. For the most severe, resistant cases, they can even use steroids. And just as importantly, they provide all this other crucial support: IV fluids to rehydrate, thiamine to protect the nervous system, and even medication to prevent blood clots, which is a known risk when you're severely dehydrated.
All right, we've covered a ton of ground, so let's just boil it all down to the 4 most important things you need to remember about hyperemesis gravidarum.
Number 1. HG is not just bad morning sickness. It is a specific clinical diagnosis with clear, measurable criteria. Number 2. It has a known biological trigger, that massive surge of the hCG hormone. 3. Diagnosis is not guesswork. It's a careful, methodical process. And finally, and maybe this is the most important part, there is a ladder of effective, structured treatments available, all tailored to what a person needs.
And we'll end on this question. Understanding all the clinical facts is so important, but we can't forget the incredible physical and emotional toll that HG takes. So, knowing all this, how can we, as partners, as friends, as a community, do a better job of supporting people going through this immense challenge? It's really something for all of us to think about. Thanks so much for joining me for this explainer.